Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the osteology of the sternum. The sternum is a flat bone forming the anteromedial part of the thorax. It has three parts: the manubrium, body or mesosternum, and the Gifford process. This is a flat bone, so it contains trabecular part, the spongy part, covered by the outer and inner table of compact bone. The trabecular bone contains red bone marrow. So how about anatomical position? The quadrilateral upper part, that is called manubrium, is directed upward. The Gifford process, the lowest tapering part, is directed downward. Anterior surface is convex from side to side, okay, and concave from above downward, especially the manubrium area, okay. So we got other part between the sternibra, also some little concavity. The superior border of the manubrium has median suprasternal notch, also called jugular notch, and the clavicular notch for on each side of the jugular notch for the articulation of the sternal end of the clavicle. Here is the jugular notch. This is the clavicular notch. This is the notch for articulation of that of the first costal cartilage. Okay. The lateral aspect of the sternum has 7 notches for costal cartilages. This is 1, 2, 3, 4, 5, 6, 7. Okay. We got the sternum here. Okay. So again, if you go there, this is the sternum, manubrium, mesosternum or body of the sternum, Gifford process. Gifford process is always variable. It may not be bifid like this. It may be pointed triangular. It may be circular with a perforation or just circular without perforation. May be deflected anteriorly, may be deflected posteriorly. Okay, so this is the jugular notch or suprasternal notch. These are for the notch for the clavicle, sternal end of the clavicle. This is the sternal angle between the manubrium and body of the sternum. This is the sternal angle. This is easily palpable even to the chest of an obese person. This is subcutaneous. This part is as well subcutaneous, and this part even palpable in a very obese person. Very important landmark for the articulation with the second costal cartilage. You can easily count the rib from here: second, third, fourth, fifth, sixth. So these are the costal cartilages. They are connected to that of the rib. So we can easily count the ribs following the sternal angle articulation with the second costal cartilage, then second rib, third rib, fourth rib. Okay, we'll go there. So it is also very important. It is the landmark for like that of the transverse thoracic plane. That plane goes transversely from the junction between the T4, T5 or lower border of the T4 vertebra, posteriorly, anteriorly through the sternal angle, also called mandibular-sternal angle, also called angle of Lewis. Okay, and this is the Gifford process. These are the sternibra, component of the mesosternum. Okay, and we have ribs for the body of the sternibra junctions here. Ribs. We have the ridges, and ribs are on the connected to the costal cartilages. So sternibra and junction between the sternibra has some ridges. You can easily palpate that, but most important is the very much palpable is the sternal angle. Okay, we got that. Now we'll go to the next slide. Here, if we just discuss that, the manubrium sternal angle, angle of Lewis, manubrial sternal joint. Okay, Body, also called the mesosternum. This is xiphoid process. This is variable in shape and size. This is the clavicular notch here. First costal cartilage here. This is the jugular notch. You can easily palpate our trachea by just passing finger over the jugular notch. You can easily palpate the tracheal ring. Okay. So this is the sternal angle here. Body, second through seventh costal cartilages. This is the xiphoid process. Okay. Now joints of the sternum. Sternoclavicular joint, clavicle articulated here on the middle side of the clavicle, articulate with just manubrium on each side of the clavicular notch. Okay, so sternal end and medial end is same of the clavicle, and that forms a saddle type of synovial joint here. Saddle type of synovial joint. Manubrium-sternal joint, sternal angle, secondary cartilaginous joint or symphysis. Inferior body of the manubrium forms a secondary cartilaginous joint with the body of the sternum. First, sternocostal joint. Sternocostal joint is a synarthrosis, a fibrous joint. Second to seventh sternocostal joints are synovial joints, but may not be very much typical synovial joint. In the lower joints, we may not get joint cavity. Okay, so we can just say they are synovial joint. Okay, then we got that the xiphoid joint, the xiphoid process, and the body of the sternum, it begins as symphysis, then it becomes continuous by bone. We call it synostosis, but it begins as a symphysis, midline joint with fibrocartilage inside. Then eventually fibrocartilage disappear. There will be bony continuation happen. Okay, these are the muscular attachment that is very important to us. Okay, this is the muscular attachment, is the anterior surface. Anterior surface will get the origin of pectoralis major muscle at the side. That include both the manubrium and the body of the sternum plus costal cartilages. Okay, it also involved, and the fascia here is also involved. Okay, that is the pectoralis major muscle attachment here. Here are the attachment of the aponeurosis of external oblique muscle of the abdomen, aponeurosis of internal oblique and transverse abdominis muscle, and here also the attachment to the rectus abdominis muscle coming to the, all of them is coming to the xiphoid process. And here is the linea alba, a fibrous band extending from the tip of the xiphoid process to the symphysis pubis. That is the linea alba that is present in between the two head of the rectus abdominis muscle extending from the xiphoid process to the symphysis pubis. It is a fibrous band. It has less blood supply. Okay, if you go to that, here is the origin of the sternocleidomastoid muscle here on the manubrium sterni. If you go to the posterior surface, this is the posterior surface, origin of sternohyoid, sternothyroid, and sternocostalis. Sternocostalis is a part of the transversus thoracis. Transversus thoracis is other part like that of the subcostalis, intercostalis intimi, and sternocostalis. This is a part of transversus thoracis nerve supply by intercostal nerve. Sternohyoid, sternothyroid nerve supply by ansa cervicalis. Pectoralis major nerve supply by means of the nerve supply by means of the lateral medial pectoral nerve. Sternocleidomastoid muscle nerve supply by the spinal root of the accessory nerve. All the anti-abdominal wall muscle has innervation by lower 6 intercostal nerves. Okay, here is the articulation. Here on the posterior aspect, we have sternal slip of diaphragm that is innervated. Diaphragm has innervation at the periphery by the intercostal nerve, but the most of the central tendon and surrounding part innervated by the phrenic nerve. Okay, sternocostal is innervated by the intercostal nerves. Okay, we got that. Now go here. Muscular attachment, we just discussed the muscular attachment, just match with that. Okay, now come this is the image I have taken from the Gray's Anatomy. The previous image I take from the JP's ebook from the Google image. Okay, these are the answer keys. This is the attachment. Look at the relationship of the pleura on the posterior surface on the left side is less than the to the right side here. This part is covered by the pericardium. Okay, covered by the pericardium. Here is the pleural relationship. Posteriorly, the sternum is related to the pleura as well as the anterior border of the lung. Here is the left lung, here is the right lung. Here is the right pleura. Here. Okay, right pleura. Okay, here is the number 8 is the transversus thoracis. The part is the sternocostal part, transversus thoracis. Okay, anteriorly, this side. Number 2 is the attachment of the sternocleidomastoid muscle origin here. This is pectoralis major. That is pectoralis major. This is the sternal angle. Here is the Gifford process is missing. We have joint, Jeffy-sternal joint. Okay, that becomes synostosis. Initially, this is symphysis. This is symphysis, secondary cartilaginous joint, but eventually it will be bony communication, no fibrocartilage. That will be synostosis. This is the jugular notch. This is the clavicular notch. Forms saddle joint to the sternal end of the clavicle. Okay. This is the joint between the first costal cartilage and the sternum. This is the fibrous joint. Okay. Synarthrosis. We got that. Now, ossification. Sternum is formed by the fusion of two cartilaginous sternal plates in the median plane. Okay, two plates come together. There are multiple ossification centers. Okay, two for manubrium, one for the first sternibra, one for second sternibra, second component of the body of the sternum, and two for the third, maybe for the fourth sternibra. Okay, so we got sternibra 1, 2, 3, 4 sternibra. Okay, here Gifford process is not shown. Gifford process center come around the 3rd year of life. Okay, that's why it is not shown here. So fusion occur, usually remain ununited. It is a symphysis. It is not united, no bony communication. This happened during the puberty. Soon after puberty, about the 40th year, these two parts join. Before that, it is symphysis. After that, it becomes synostosis. Okay, sternum has a lot of variation. The perforated sternum, there may be gap here because two plates come together. There may be gap here. Maybe there may be gap here between the sternal component. Pectus excavatum. Sternum may push back. That may happen after birth or usually at puberty. Okay, it may compromise the respiratory function, may not compromise respiratory function, cardiovascular function. Pectus carinatum, pigeon chest. Sternum is pushed forward. Okay, that may also happen after puberty. Usually these are not congenital. That happens after birth. Variation of Gifford process. It may be bifid, it may be pointed, it may have some ring appearance. So Gifford process is very much variable, maybe inverted, maybe outverted. So it is variable. Clinical anatomy. Sternum is very important to pick up bone marrow because it is a flat bone. It contains the trabecular part. Okay, so we have, it may be, you may take the bone marrow from here by bone marrow puncture needle. Okay, we do sternotomy to separate out the sternum to do the open heart surgery, especially in coronary artery bypass grafting. Okay, we can do that part. And we have the median jugular notch. We can count the, even we may not count, we may feel the ring of the trachea. This is the sternal angle. We can count the ribs from the second costal cartilage, third costal cartilage, second rib, third rib. You can count the ribs. Okay, and sternal angle is a landmark for the transverse thoracic plane. Okay, that's all about this. Okay, so sternum may go through fracture, especially in road traffic accident, but luckily due to we have airbag in our car, our sternum fracture is little bit decreased in incidence. Okay, but it may be fractured. And